Hi, I am Dr. M.R. Pujari. I am dental surgeon as well as implant specialist at iSmile group of dental clinics, Bengaluru, Karnataka. Ideally, the tooth we consider enamel as the hardest tissues in the body. It is harder than the bone. It can crush even the hardest food. But once the tooth is affected by cavity, if there is already a cavity which you are unaware, if it has made a bigger hole in the enamel, there is high chances that the tooth can fracture on its own. A small part might come while having food in your mouth. You might feel it as a part of the tooth or a stone. Yes, tooth can fracture when there is an existing cavity or a hole in the tooth. That is the common cause of tooth fracture. We call as a tooth decay. In that case, if the fracture is smaller, doctors normally do fillings, especially the composite filling. But if the tooth fracture is little deeper, then doctors might recommend a root canal treatment. Another reason of a fracture of the tooth is while having harder food, or sometimes the patients try opening the bottles. They are having very hard crunchy food like non-veg, you are having some bone, you tried crushing the bone. That time also the tooth are not that strong. If they are brittle in some patients, if they are brittle, then that the tooth can fracture. Again, the treatment modality is based upon the symptoms. If it is symptomless, normally doctors will do composite filling, and if the symptoms are there, we recommend root canal followed by a cap on such tooth. So a broken tooth, it could be due to a deep cavity, or it could be due to a brittle tooth if it is fractured while having very hard food. In both the cases, we can actually save the tooth based upon the condition. If the tooth fracture is on the top portion of the tooth, that is enamel or little dentin, we can always do it with the filling part, or we can even do a root canal and put the cap, we can save the tooth. But if the tooth fracture is pretty deeper, or if half of the tooth is broken, that is very tough. Sometimes we do root canal, we do post and core, and we try to save the tooth. But if it is extending to the root level, it is very tough to save the tooth. In that case, we ideally recommend patients to get the tooth extracted and then go replacement with either implant or a bridge. So a broken tooth due to different reasons, or if it is due to infection or due to tooth decay, if it is untreated, if the dentist, you went to dentist advised some treatment and you couldn't follow it up, such tooth normally always invites for infection. So if there is an untreated molar, you have not done any treatment like filling, root canal, nothing is done, and it is staying there without any kinds of pain, it often attracts the food particles, the bacterial invasion, resulting in more infection in the same tooth, as well as it can act as a spread to the adjacent teeth. So untreated molar always has to be extracted. If you can't do root canal, you can't do extraction, then it is always better, then you can remove it off, and then once it gets healed, you can always go for a replacement of a new teeth. So a tooth always can be saved by root canal if the tooth is broken. It could be due to cavity or a fracture. But when to choose, that always depends. If your tooth fracture or the decay is up to the gum line, we can actually save it. The criteria is if the fracture or the tooth decay is actually extending up till the roots, then it is very tough. The foundation, the tooth support is basically roots. If the roots are damaged, fractured or a decay, we cannot save the tooth. But if it is above the gum line or below the gum line, we can always do root canal treatment and then put a cap on that to save the tooth. So in case of a broken molar due to cavity or a fracture of the tooth, we cannot save it. Doctors will advise for extraction. Once it extraction, we have better modalities, either through implant. We can nowadays do immediate implant. With that, under local anesthesia, we can remove the tooth and put implant on the same day, and after 2 weeks actually we can put the permanent teeth on that. Another modality is old technique, where we remove the tooth, we extract the tooth, and then we wait for at least 15 days to 1 month for the proper healing, and then we go with the bridging technique, which is basically taking support of the adjacent teeth and then putting a false tooth in between. So that's called bridge. So both modalities are available. Once it heals properly, we can always do that, either implant or dental bridge.